think you articulated that well there, Chris. You know, in Te Ao Māori we have a saying, and it says, he aha te tīmata o te matauranga, koina he whakaaro noiho. So really articulates, I guess, what Ruth started talking about then, others have demonstrated throughout the day. How does knowledge start? It starts with a thought, and how does an individual change that paradigm within an institution? They can do so, and you have to become change champions. And I think, you know, you're absolutely right, Chris. How lucky are we? We've had a fantastic day with wonderful speakers. All great to come to a hui, but what next? What happens when you walk out of this room here today? What can you do tomorrow, whether you're a clinician, whether you're a provider? And I think that TED talk that you showed this morning in terms of David in there mentioned, you know, something had happened in 1974 and they were still trying to gain traction around that. Well, 2,500 years ago, Hippocrates said, know well the person in front of you well before you come to know about their disease. You know, we're still in this space. I was thinking when Hillary was talking around the hospitals, etc., and that environment. Well, Princess Tapuia, many years ago, she went to the government and said, you need to fund and recognise Mahinarangi. Mahinarangi is the big wharenui at Turanga Waiwai as a hospital. And the documentation she received at that time was, no, it can't possibly be a hospital because it's not grey and it's not concrete. And they specified all of that. You know, so great that we're in this paradigm now, but we don't need to have that much time to gain some more momentum around this. So, you know, great ideas about thinking where we can go to next, and whether it's simply around what Rowena said around replying or responding to the article that she saw, or Janine and her wonderful presentation around Health Navigator. And as a clinician, I can certainly endorse Health Navigator, but yeah, let's be thinking more about this space. So I guess we're opening up the floor to do so. Just one final point there. I think David asked a very pertinent question. He and I were chatting at lunchtime today, but around getting clinicians more involved, and don't underestimate the power of a consumer and a direct clinician involvement too. And I'm thinking specifically last week in Heretaunga, where Graham Norton's from, not Graham Norton of the Red Chair, but there was a tangi in Heretaunga last week of a young man, 44 years of age, who became the consumer video face of One Heart Many Lives. I'm not sure if you're all aware of One Heart Many Lives. Tamati Davis, he personified what many of you spoke about today. I know Lisa at my table asked about how do you get people who don't typically engage, how do you hear their voices? I know Michael and Claire, you've asked similar things and throughout the day. Well, Tamati was one of those people. He was male, he's Māori, he was overweight at the time, and that snowballed into him being extremely overweight because he would not engage in a health system. He just would not go and did not go at any stage of his adulthood until it came out of his control. And he had a significant heart event that he ended up having heart surgery for. And Norm Sharp, Professor Norm Sharp, I don't know if you all know Norm, cardiologist that just stepped down from the Heart Foundation as the head there. Wonderful man, 25 letters after his name and well respected by his peers. But he will still stand in front of you now and say that he had no impact with his own peers in terms of them understanding the voice of a consumer until Tamati came along. Tamati went through as a patient and a valued member of the One Heart Many Lives team. But he got to a space where he could advocate for other people, and he spoke of his experiences in hospital, and he showed clinicians his physical scars, but talked about those mental scars too, and how things really affected him, being talked in the third person as a patient, having to be weighed outside near the kitchen area, and what that did to him, all of those sorts of things. And that Norm didn't see any change in behaviour until Tamati was walking that journey with him. So I just thought, out of respect to Tamati, I'd like to mention his name today. But On that note of giving thanks, certainly to Linda and Chris and acknowledging the Health Quality Safety Commission again, but importantly all of you, and can't advocate again as you walk out of here today, make a note of, evidence tells us if you write something down you're much more likely to do it, but what you can contribute to more in this space tomorrow in your working environment or wherever that is. Hewa anō, ka tae mai te whiuri o te kiori. Nō reira, tēnei te mihi ki a koutou, tēnā koutou mō tō koutou tautoko o tēnei kaupapa whakahirahira, tēnei kaupapa whakahirahira kia ki te hauora mō ngā iwi katoa, koe nā te mea nui nera. Nō reira, he karakia whakamutunga mō tātou. Kia tau, kia tātou katoa, te ata whai o tō tātou ariki a ihu karaiti me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu, ake, amene. Kia ora mai tātou, go safely, go well.